Hello everyone, this is Dr. Stan Gross. I'm the president and co-founder of Sano Global Nutrition. I want to talk a little bit today about DeFlame. DeFlame is a natural approach to inflammation management. Now, this presentation might get a little technical, but I will take the technical information to a level where most people can grasp it, or at least I hope to. And if not, please give me any questions that you have at the end of the presentation. So if we're talking about inflammation, there are some that believe, and I tend to follow, that inflammation is one of the stronger underlying causes of many, many, many different disease functions, such as cancer, pulmonary disease, neurological disease, autoimmune diseases, arthritis, diabetes, Alzheimer's. Pretty much anything you can name has an inflammatory edge to it, doesn't it? And I'm sure you don't think of it that way, but what happens is once we become inflamed, and we'll cover the reasons why, we tend to cascade things. They build on top of each other, right? And so it tends to cause not a great dependence of inflammation, but a degeneration. So let's look at some of the effects inflammation has on the body. And it says inflammation is the root of practically all known chronic health conditions. And I agree with that 100%. If we're looking at the brain, we have pro-inflammatory cytokines. Interesting name. What that is there are cytokines or communicating cells in the body that tend to want to increase inflammation. Well, why would we want to do that? Well, if we have a genetic firing, something in the genes, which would be like an autoimmune thing, right? Or if we have an injury, or if there's an infection, or if there's degeneration, such as the case with Alzheimer's, where you have the plaquing and the pitting. Autism, there's all kinds of speculation on how that begins. But certainly there's an inflammatory issue going on that makes it manifest. And here's the problem. We're seeing more cases of autism, more cases of Alzheimer's, more cases of neurological degeneration, ALS, PLS, multiple sclerosis, much more than we did 2 decades ago, and certainly much, much more, almost 300-fold more than what we saw 50 years ago. If you're looking at the skin, you don't think much about the skin, but if the skin becomes inflamed, that's typically a sign of either liver or kidney involvement, right? So dermatitis, eczema, acne, psoriasis, wrinkles and fine lines, that's all a sign of that's aging and degeneration, but it also may be a strong sign of what? Toxicity. And so things that cause toxins in the body, and that could be, from cigarette smoke, that could be from pollutants in the air, it could be from the SAD effect or standard American diet, anything like that could affect inflammation in the skin. Cardiovascular. #1 killer in the world right now is cardiovascular disease. So inflammation around the heart long-term helps with plaque development and closure and constriction of the arteries around the heart. And so that leads to high blood pressure. In some cases where these emboli break free, we could have strokes. We could have rupture of the walls of the arteries in the brain. That could cause a stroke. And certainly we could see things like obstructive ischemia, myocardial infarction, which is what? It's heart attack. And then we're talking about diabetes and anemia. That's all part of it. When you're dealing with an inflammatory issue over time, it affects, every system of the body. So let's look at the kidneys. Again, these inflammatory cytokines, right? They restrict the blood flow to the kidneys, and right on top of the kidneys are the suprarenals. Kidneys are renal glands, and above the kidneys are suprarenals, or we call them adrenal glands. That's our stress hormone source, right? That's cortisol. So if that happens over time, you end up with hypertension as a result of inflammation to the kidneys. So, and nephritis, kidney failure, even development of kidney stones. What about your bones? We think of bones as just hard structures, but it's living tissue. And bones are also where our T cells, our immune cells come from bone marrow, right? Well, if that's depleted, we have less red blood cell production, less immune cell production, and the uptake of all the essential minerals to the bone to keep it structurally sound are depleted. So there's chances of spontaneous fractures, osteopenia, osteoporosis. Then we cross over the next column to the liver. And you have a buildup of inflammation that leads to an enlarged liver. Many of us have a fatty liver out there and we don't know it. So where does that come from? Typically, long-term dietary abuses, things like alcohol certainly can cause fatty liver, but having foods that are depleted in essential nutrients, especially our essential fatty acid sources, if we're dealing with nothing but saturated fat and bombarding the liver with the means of producing the enzymes to break that down and the steroidal type substances to keep it in the body as a usable substance, we call that cholesterol. Yeah, cholesterol, that comes from the liver. So, and if we overtax it, then the liver becomes infused with fatty tissue. What about the thyroid? How many of us are dealing with autoimmune issues with the thyroid? Man, I got to tell you, long-term issues with thyroid right now, especially understanding that the number one deficiency in the world is iodine. It used to be in our food. It's not so much anymore. So we're not getting as much. We're told not to salt our foods as much. So we need to remedy that. And we have an answer to that in our lineup of supplements. So long-term inflammation can cause degeneration, autoimmune response in the thyroid, so Hashimoto's, where the thyroid goes up and down and up and down, eventually just crashes. These nodules appear, sometimes they become tumorous. They can lead, in some cases, to medullary carcinoma, so cancers of the thyroid. Long-term inflammation is dangerous, folks. Inflammation of the lungs, well, most of that's self-induced. You know, smoking is the number one reason for inflammation of the lungs. However, there are environmental things. If you live in a house that's, older and it's not maintained well, and there are leaks where there's a possibility of black mold, well, that's a big issue, huge issue. And that compromises not just the lung tissue, but the immune system as well. The GI tract. GI tract is, the old German physicist and physiologist years ago, because they joined physics with medicine in Germany many, many years ago. And they used to say death hides in the colon. Well, it kind of does, If you look at what we're putting in our bodies, especially foods that increase inflammation, we tend to do it on a regular basis. In fact, sometimes we even crave it. That's insane, isn't it? We're craving things that are actually doing us harm. And that you don't necessarily have to have celiac disease. You can just be extremely sensitive to gluten and gliadin. We'll get into that in detail and I'll show you. But there are other things as well. Just a really sucky diet, or a standard American or standard European diet, can be just detrimental to your health. We need to change that and lift our quality of life by lifting the quality of our food. Muscle inflammation of the muscle, anyone who's over 30 can understand that almost directly. Here's why. we stop producing as much muscle or the ability to produce lean body mass once we get over 30. It just depletes more and more and more. We're producing less ATP. We're not doing as well. And what inflammation does, it lays down a matrix of fibrous tissue till eventually the muscle atrophies to an unusable level. If you need evidence of what that looks like, go visit a nursing home sometime. That's what it looks like. So we have an obligation to get the muscle pumping because metabolism is driven by the engine, and the engine is the muscle. Okay, now we got a little bit better picture, don't we? So let's get into some biochemistry, all right? Arachidonic acid and metabolites and inflammation. Okay, what that means is things that produce arachidonic acid, because the arachidonic acid cycle leads to COX responses, COX-1 and COX-2. You've all heard on the, the prescription ads for things that are COX-2 inhibitors. That means it inhibits the production and distribution of COX, or cyclooxygenase products into the bloodstream, which then is converted into what? Prostaglandins. Well, we don't think of prostaglandins too often, do we? Well, prostaglandins are metabolic activators. They're the things that promote certain types of reactions to take place. And if you look to the left, you see the prostaglandin, which causes vasodilation, inhibits platelet aggregation. That looks okay, doesn't it? Uh-oh, let's look on the other column with thromboxane. It causes vasoconstriction, promotes platelet aggregation. And then we look at the bottom and we see that vasodilations increase vascular permeability. What does all that mean? Well, what it means is if we're in an inflammatory cycle, in other words, where we're doing the wrong things over and over and over again, if we have COX-1 and COX-2 reactions in the body, we're constricting the blood flow, we're causing platelet formation and clotting within the blood flow, we're increasing pro-inflammatory hormones, the wrong kind of prostaglandin, and we're increasing susceptibility for the bloodstream to take on toxins. The permeability factor goes both ways. We can either take on good things or we can take on bad things. This increases the cascade of toxicity. Then on the right side, if we're looking at lipogenase and how lipogenase is broken down to the leukotrienes, leukotrienins, are specific types of enzymes that are associated with leukocytes. What are those? Leukocytes are immune cells, right? And so if we're looking on the far right side where we have chemotaxis, if that takes place, that means that there's an invading body chemotaxis. We release toxins to destroy foreign substances. That's a good thing. If, however, that is inhibited, we end up with things like bronchospasms, increased vascular permeability, same problem here, and vasoconstriction. Oh my goodness. And at the bottom we see where it inhibits neutrophil adhesion and chemotaxis. It shuts down the immune system. So if we have inflammation for short term, it's okay, we can overcome that. But what if it lasts for 2 weeks, 2 months, 10 years, 15 years? What are the possibilities of building up an inflammatory cycle that keeps repeating and repeating and repeating? Arachidonic acid sources, we're looking at junk food. Junk food's number one, smoked meats, fried foods, anything that's aged, anything that's processed, arachidonic acid. Sorry to break the news to you. So here's your inflammatory food: gluten-based, fried foods, Highly processed foods loaded with sugar. Pastas, why? Pasta's gluten. Not only that, to hold pasta together, they used to use what? Potassium as a stabilizing sugar, stabilizing mineral. Now they use bromide. Sugar, 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 sugar. Is it everywhere? Yes, it's everywhere. Don't believe me? Do the measurements. Check the sugar count and total carbs in things like Coca-Cola and so forth. You'll just be shocked. So let's talk about good old what? Wheat. Here's the problem. If you look at the very top, see that thing that says brush border up here? Right up there. That's set up so we increase the actual surface area of the gut so that things that pass through has more surface area to absorb nutrient. That's the whole idea. So you can see we can have mechanical stress, chemical stress, or infections. It could be bacteria, it can be virus, could be fungal, could be, whatever you want. Now you see these gaps are normally fairly close. All of a sudden you see the gap widen. And you see these things passing through that aren't supposed to pass through. And you see down here, at the bottom, all of these immune cells going to work to try to reverse the process. Well, this is called leaky gut. And when it passes from the mucosal tissue into the interstitial tissue, it calls for the body to have an immune response. And in some cases, for prolonged issues, it will have an autoimmune response. So we're looking down here at the immunoglobulin G. That's typically what we would see in what? Like celiac disease. But not necessarily. It can also come from somebody who likes bread with every meal. How many Americans are like that? We have toast or biscuits or whatever for breakfast. We have a sandwich for lunch, and then we have to have bread with our meal at supper. We've overloaded our system with this gluten. The type of gluten now is different than the type of gluten that was around, say, 20 years ago or 30 years ago. They're talking about a different chemical altogether. And as a result, we're taxing all of these immune cells, these dendritic cells, and these macrophages. And as a result, we're depleting TNF, tumor necrotic factor. So we're building up pro-inflammatory responses, and we're not being able to control it over time, and we're setting ourselves up for disease. Let's increase the thought on this. Let's go to the byproduct of gluten, which is gliadin. See it here. Gliadin causes an IgA, an immunoglobulin A response. So as it gets into the microphyllae, remember that raised area that just raises the surface area percentage? As it becomes embedded, it infiltrates. And this is an active celiac disease, and this is under control. But it doesn't have to be celiac disease. This illustration is just a sign on how gliadin actually causes an immune response within the mucosa. So we have an inflammatory issue in the intestines itself. So gluten passes through, causes leaky gut, and the inflammation goes in the interstitium and into the bloodstream. Where gliadin causes an inflammatory response within the gut itself. So now you're really inflamed, inside and out. Don't want to do it. Not good. So phospholipids on the top, that's the barrier that protects most of our cells. It protects the mitochondria. And if we're looking at anything that breaks its way through, it causes what? There's that word, arachidonic acid again. But we're also looking at different types of chemicals in here that you're not expected to memorize them. But as you're looking, what's happening here is a cycle of inflammation over time. And there's the Cox reaction again. If we're looking at this, this is building up what? This is building up a large number of free radical oxygen molecules that when they release, when they reach a saturation point, it totally disrupts the phospholipid barrier and makes it 100% permeable to just about any type of pathogen. Plus, if it permeates and gets its way into the messenger RNA, memory RNA, that's going to be transported to another cell, now you run the risk of producing what? Cancers. So DeFlame was formulated to modulate the arachidonic acid cycle, thus controlling the pain and the inflammation associated with it. Yeah, it's a really complex formula, but it was so much fun to see this come together. Now we're looking at soft tissue. And this can come from injury. It can come from, things like fibromyalgia. This is the story we're looking at. So if we have an injury for whatever, it could be bacterial infection, toxins, trauma, whatever, you see these fibrils that make their way into the sarcomeres within the fibers of the muscle or connective tissue. And if it corrects itself, see this resolution? It seems to be fine now. And the surrounding vascular tissues are great. But if it progresses to the inflammatory stage, we've got problems. All these connections start breaking up. And we can get here where you've seen infections where there's pus formation, cellulitis, infectious issues that get into the soft tissues that doesn't necessarily have to be just infectious. It can be any type of persistent injury that you're doing over and over and over again, or inflammation that triggered a dormant gene to produce an autoimmune disease like rheumatoid arthritis or ankylosing spondylitis. And then finally you end up here down in the far right where you have fibrosis. And now the tissue has a total loss of function. It cannot be repaired, and there's nothing you can do. But in this case, there are answers. There are ways to get around this, but the first thing we have to do, and foremost, is break the inflammatory cycle. Mast cells, what are those? Well, that's really the essence of our attack when we're looking at our immune system, because mast cells, set up the messenger system to help us find when something is not working well. So when it goes through degranulation, here's a normal mast cell, and it's got all of these different messengers that trigger response. So it can increase vasodilation, the testosterone, estrogen, progesterone, cause it to react to whatever's going on in its environment. So if you have parasitic infections, allergens, stress, anything that causes this to respond, it will fragment like this. When it does, it produces cytokines. These cytokines communicate with other cells and say, something's gone wrong over here. We have a problem, we have an infection, we have an injury, we have a long-standing issue that isn't going away. Histamine in some cases is produced if there's a bee sting, if there's something that the body needs to respond to quickly. Inflammatory hormones and inflammatory chemicals are released. Here's the problem. If it happens time after time after time, the body starts adapting, so the signal has to get stronger and stronger and stronger. So the more we ignore these types of symptoms, the more likely it is this cycle becomes destructive and eventually goes into what's called deposition phase. We go from an inflammatory phase to a deposition phase. What does that mean? Well, you see it on x-rays, right? You see people that, man, my back hurts. It's hurt me for a long time, but it really hurts. And they put up the x-ray, and you got these spurs and lips that sit on the edge of the vertebrae or in the shoulder or the elbow, whatever affected joint it is. That's deposits. That's a deposition phase following inflammation. If the skin is constantly irritated from chemicals or from sunlight, we get skin tags or enlarged nevus, larger moles. That's deposition. That's the body's way of trying to set up a defense mechanism against long-term inflammation. Interesting, huh? So if we're looking at the cycle, if we're looking at essentially an overload of omega-6s, that's junk food, by the way, we get omega-6 from just about everything out there that has a fat. So we're not in balance. We don't have the right amount of omega-3s against our omega-6s. And if that inflammatory process takes place long enough, what will happen is the chains, the long chains that are supposed to be held together will be broken up, and that inflammatory cycle will be what? Will be self-perpetuating. And all of a sudden you've got all of these normal strands that are supposed to be almost globular in nature until they're going to be used are now broken up into triglyceride globules that will eventually do what? Eventually they will cause clotting. Eventually they'll cause hydroxyls. Hydroxyls are the most predominant inflammatory substance in the body that produce free radicals. Let me say that again. Hydroxyls are the most abundant inflammatory substance in the body that produce free radicals. We need to fix that. Within DeFlame, we have serrapeptase at 40,000. What's SPU? Well, SPUs are serrapeptase units. And papain. Papain comes from what? Papaya. We have 500,000 PUs, papain units. We have bromelain from pineapple, 500,000 PU, which again is papain units. In bacterial protease, HUT, that is hemoglobin units with tyrosine. That's how it's driven into the blood. And devil's claw root extract, we're looking at 100 milligrams. No, the bacterial protease was 50,000. Devil's claw root extract was 100 milligrams. And if you're looking at the PC, PC is looking at your platelet counts. So how many of the units can be bound to platelets within the bloodstream? That's what it amounts to. Then white willow bark, that's nature's aspirin, right? So is ginger root extract. And that's your formula. It is fantastic and it works well. 2 delayed release vegetable capsules per serving. Most people can get by and get relief with 2 per day. In severe cases, 4 per day. DeFlame addresses the inflammation on multiple levels, not just the arachidonic acid, but also the substance P, which is what pain cycle is, right? It's also what addiction cycle, get that. Addiction cycle is linked to substance P as well. So as we're breaking down all of these different pathways, we're decreasing inflammation and therefore decreasing our dependence upon the things that cause inflammation. DeFlame is safe and effective for all ages. It's a natural solution to pain and inflammation. With small children, it wouldn't go more than 2 capsules a day. and their inflammatory issues should be evaluated first by somebody who understands pediatric physiology and also has a strong base in natural healing substances and clinical nutrition. So I bet you got questions now, at least I hope you do. We have a lot going on with this product and there's a great demand for it. If you have further questions, please post them. I look forward to answering them. Hope to see you soon. Bye-bye.